All right. Good morning, everyone. Welcome to our second to last Coffee and Conversations. This morning, we have the pleasure of having Dr. Samia Abdelnabi joining us to speak about her work and which aims to advance equity in reproductive health through the lens of Muslim American women. Um, so I'm going to go ahead and introduce her while people are logging on. Um, as a nurse scientist and nurse midwife, Dr. Adelnabi's research focuses on improving quality of life in Muslim American women. Her current study is focused on understanding the facilitators and barriers on reproductive and sexual health knowledge in Muslim American women. Dr. Abdelnabi's work also includes completing her dissertation on the lived experiences of second generation Muslim American women with infertility and understanding to what extent sociocultural and religious factors impinge on the decision to seek treatment in reproductive health. Dr. Abdelnabi is interested in developing programs to promote reproductive and sexual health in racial, ethnic, and marginalized groups. Her future directions also include creating and developing interventional programs using traditional Arabic and Islamic medicine to promote or enhance psychosocial well-being in Muslim American women with infertility. Thank you very much for joining us this early in the morning. And I will go ahead and mute my own screen and let you unmute and go ahead and get started. Once again, folks who are joining us, feel free to ask questions in the chat or to jot them down and remember them to ask at the end of the presentation. Thank you very much for joining us this morning.
Good morning, everyone. Again, thank you guys for coming. I know it's kind of early, so I really appreciate you all for being here and hearing a little bit about my talk. So I'm going to pretty much talk a little bit about my dissertation and the research that I did and a little bit of the research that I'm doing currently. So the title of this talk is Advancing Equity and Reproductive Health, because everything I do, whether it's an educator or as a clinician or a scientist, revolves on advancing health equity, especially in underrepresented groups, specifically Muslim American women. And just a little bit of background about me. To the left, you'll see my childhood home, and in the middle, you'll see a picture of me as a little one, and a Chatsey High School, which is my high school back in Detroit, and then this view of Detroit City. So my personal connections to the communities in Detroit and my drives my dedication to care for women from ethnic and racial backgrounds. Raised in Detroit, a city celebrated for its cultural mosaic, I grew up marveling at the diversity of perspectives and the richness of ideas unique to each individual. I always felt a sense of belonging and rarely faced questions about my identity as a Muslim American. During my formative years in school, discussions with classmates revealed that subjects considered taboo in my culture were very similar and sensitive in others. And my cultural and religious backgrounds and experiences was deep rooted to my professional calling. So as a Muslim Middle Eastern American, I became particularly aware of the cultural silences around surrounding women's health. Topics such as simple topics as like menstruation was shrouded in mystery. This lack of knowledge wasn't just unique to me or my cultural background, but I also noticed the same gaps among my other peers and relatives. This realization fueled my decision to pursue degrees in nursing and midwifery. So my mission is to empower women through candid discussions and education about their bodies and health by educating both women in my care and future nurses about the cultural nuances that hinder discussions of reproductive and sexual health among ethnic, racial, and religious minorities. I hope to enact some change. A little bit about my background and my training. I completed my bachelor's, master's, and my PhD at Wayne State University, which is in the heart of Detroit. And I completed a postmaster certificate as a family nurse practitioner at South University, which had a campus in Novi. And I'm currently at the end of my second year as a postdoctoral fellow with the National Clinician Scholars here at the University of Michigan. And my overall experience as a nurse started on the cardiac step-down unit. I worked for 2 years on the cardiac step-down unit at Oakwood, which is now Corewell Health. And then I moved to labor and delivery for a couple more years. And then I've been a midwife for the past 15 years. Upon contemplating the essence of my personal identity and aspirations in the roles of a practitioner, educator, and investigator, I have begun to crystallize my purpose. And so my mission is again to reduce maternal morbidity, mortality in underrepresented groups, specifically Muslim women. Health equity and a phenomenological view are the foundational elements that guide my methods in teaching, providing patient care, and conducting scholarly research. In pursuit of health equity within reproductive and sexual health, the goal is to ensure equitable access to services for everyone, transcending differences in identity, economic status, or location. This involves providing inclusive health education, varied contraceptive options, safe pregnancy care, STI prevention and treatment, aiming to remove barriers and promote optimal health for all. Specifically for Muslim women, several health disparities exist. There's a cultural stigma, so norms and stigmas can curtail open dialogue about sexual health, limiting knowledge and healthcare control. There's access issues, so barriers to care might include lack of culturally sensitive services, language differences, or non-inclusive insurance coverage. And there's educational shortfalls, so there might be inadequate or insensitive education on reproductive health. It can cause misconceptions and unawareness of entitlements. Provider bias. Healthcare provider bias can impede the delivery of quality care and damage trust. And then, of course, there are research gaps. The underrepresentation in research leads to a dearth of specialized health guidelines for Muslim women. So shifting more to like my research. So my journey through teaching, personal encounters, and clinical practice has steered me to embark on a PhD with research centered on reproductive health within Muslim communities, approached through the lens of health equity and phenomenology. And in the middle, you'll see my two little ones who are now 4.5 and 1.5. After grappling with infertility for 3 years, I delved into the existing literature to discover if other Muslim women shared my internal struggles surrounding IVF, the guilt associated with feeling impatient about infertility, the Islamic perspective on these challenges. My search revealed a significant gap in the literature concerning the experiences of Muslim American women. Additionally, I noticed a scarcity of support groups and therapists addressing infertility with an understanding of Muslim concerns. Although I did locate one group in Canada, and at that time, before the pandemic, you actually had to go to Canada to be part of that support group. And after the pandemic, they allow outside people to come into that group. And even today, I haven't found that many groups that support Muslim women through infertility. Therefore, I was motivated to explore the lived experience of Muslim American women dealing with infertility, aiming to uncover insights that could assist other women navigating this challenging path. So a little background, just a little information on the prevalence of infertility. It actually has increased. So for about 20 years, the rate of women and men who suffered infertility kind of stayed the same until the last probably 5 years, and has increased from 8 to 12% globally to 17.5% globally. How a woman experiences a diagnosis of infertility may differ based on many factors, such as their education, their socioeconomic status, their culture, the societal pressure, and their religiosity or spirituality. Infertility is considered a socially constructed process that requires an individual to embrace parenthood as a desired social role. The centrality of motherhood to a woman's identity is shaped by the socio-cultural context of fertility. Infertility's emotional impacts can be amplified by cultural expectations to have children. Women often endure profound emotions, including loss, despair, and a sense of inadequacy, contributing to identity crisis and lower life satisfaction. Persistent infertility can lead to enduring social isolation and grief. Regarding Muslim women, little research addresses their specific infertility experiences, most studies being confined to Muslim majority countries. Despite facing emotions common across cultures, Muslim women experience unique challenges, including negative self-identity, the stigma, societal pressure, and in some cases, confront abuse and religious constraints. For Muslim American women, particularly second or third generation, there is a research void. Their identity, influenced by both faith and American culture, may affect how they handle infertility, altering their reproductive decisions. A lack of understanding about these cultural nuances among healthcare providers can lead to further alienation for already isolated couples. Thus, for my dissertation, I aim to fill this gap to provide a deeper meaning and understanding of the experiences of Muslim American women with infertility. Research on reproductive decision-making among Muslim women, including fertility treatment choices, is scarce. Islamic teachings allow Muslim women to make informed decisions on things like contraception, abortion, fertility treatment within specific guidelines, which suggests autonomy in such matters that not always reflects in societal norms. Women in patriarchal contexts might face restrictions and family planning choices. A Muslim woman's religious beliefs, adherence to the Islamic law, personal lifestyle also play a role in her approach to seeking infertility treatment. However, cultural values and distrust in the healthcare system can deter Muslim women from seeking care. Concerns over modesty and fear of cultural insensitivity can delay preventive health measures. Worries about being mislabeled as oppressed or uneducated may further hinder the pursuit of healthcare. The influence of cultural and religious beliefs on reproductive healthcare decisions among Muslim American women requires further exploration to provide culturally competent care. And prior to completing my dissertation, I completed a literature review that revealed insights into the experiences of Muslim women from Muslim majority countries concerning infertility. Three key areas of impact were identified: their emotional responses, interpersonal relationships, and social relationships. 6 themes emerged highlighting infertility challenges, which was their identity crisis, low self-esteem and depression, abuse and harassment, a weakened marital bond, stigma, social exclusion and isolation. And a summary of the themes are presented in this table. The study showed the intense pressure on women to have children and emotional toll, including altered self-identity and low self-esteem resulting from this expectation. One thing that I found that I don't see a lot in other groups was the abuse and humiliation linked to infertility. And this could be that more women were talking about it, or it could be something that was more prevalent within this group of women. Thus, based on the need to fulfill the gap in knowledge on the experience of Muslim American women with infertility, the purpose of the study I completed was to describe and capture the meaning of the lived experiences of Muslim American women with infertility to provide a better understanding of the factors that assist or hinder Muslim women from seeking infertility treatment. I completed a qualitative study, and I followed Van Maenen's methodology to study the lived experiences of Muslim American women with infertility. Van Maenen uses a 6-step approach that employs the philosophical assumption and approach of phenomenology and hermeneutics. Van Maenen describes phenomenological research as a way to understand how we experience the world through the intentional acts of attaching ourselves to the world. The lived experience of Muslim women with infertility is best developed through gaining access to their pre-reflective or first-order lived experience, which provides a detailed understanding of the essence of their lived experience in their life world. Based on a review of the literature and gap of knowledge, 2 research questions were employed. So the first question was, what is the lived experience of second-generation Muslim American women with infertility? And 2, to what extent do social, cultural, and religious factors impinge on the decision to seek treatment and reproductive care, specifically infertility? The data that were collected came from a sample of 12 Muslim American women who were recruited using purposive and snowball sampling. The women were between the ages of 27 to 41 and struggled with infertility from anywhere from 1 year to 16 years. All were born in the United States. All participants were second-generation Muslim and Middle Eastern Americans, and the majority reported having either primary infertility or unexplained infertility. And then in terms of recruitment, because it was during the pandemic, it was harder to go to a lot of the offices and recruit on site. So I relied mainly on social media. Interviews were informal, semi-structured, and an in-depth interview and a responsive interviewing style. Participants received an information sheet prior to the interview, and most interviews lasted about 30 to 90 minutes. And here's kind of like a sample guide of the interview guide. And I did 2 interviews. I did one interview just going over the interview guide, and the second one, I would go over the things that I found from like the themes that they described and confirmed that this is kind of what they were saying. And then I would address any other questions that kind of came up. That's the nice thing about qualitative research. You do one research, you do the coding, you kind of see like, oh, look, I should have asked maybe another follow-up question. And then you can kind of use that to guide further questions that you ask other participants. Um, let's see. So after each interview, interviews were transcribed, coded, and analyzed, and then I returned to the field to continue with interviews. And then once themes did not recur, the study was considered complete. Those 12 participants allowed me to reach that saturation. And then I used thematic analysis using Van Maenen's method to uncover themes that embodied evolving meanings of the work. And then going back to the research question, what is the lived experiences of second generation Muslim American women with infertility? There were 8 themes. So here you can see on this side the 4 themes, and within the bubbles it kind of goes over what my participants were saying. So we have discovering difficulties of conceiving, seeking reproductive care, life decisions, fertility expectations, rationalizing fertility status. And for one participant, when she talked about rationalizing why she was infertile, um, she's she said, I was trying to understand really why God is putting me through this. Maybe it's for me to help other people. So she felt like now she actually ended up making a Facebook group for women with infertility. And so she felt like maybe that was her purpose of why she was going through it for infertility. And then in terms of like decision making, um, one said, I'm scared. I feel like I'd be going behind God's back, like I'm forcing something. So when it came to accepting infertility treatment, she was having a hard time accepting IVF. She was okay with doing everything else, but when it came to actually IVF, she had a feeling that she was going behind God's back. And I've actually heard that quite often with other participants. And then the emotional toll. One said, if I knew that I was going to suffer with infertility, I wouldn't have waited one day. And so that was a recurring theme and kind of what led me to move on to the next research topic that I will briefly talk about, is that they didn't know a lot about their body, and if they would have known that they had PCOS or endometriosis, that these things could cause infertility. So knowing their body better and knowing those symptoms, they would have changed kind of some things in their lives. Dynamic relationships. Um, One said, I feel like I've just become so bitter. Whenever I see anybody announce anything, I'm genuinely happy for people, but at the same time, she kept saying she was sad for herself. Pursuing support, and then identity. So in terms of reflecting, so the findings of the study provided a glimpse into understanding the lived experiences of Muslim women with infertility. However, what many women talked about were religion and community often. So they felt like they had good support within their family, but they didn't really discuss a lot. So it was, okay, I told my parents or my mom or my sister that I was suffering infertility, but it wasn't that I needed support from them because they didn't understand what I was going through. They talked about community, that the community is it's very stigmatized to talk about infertility. So when you go out there, it's like, okay, you have to have children. You should be married by a specific age. You should have children by a specific age. And if you don't, people are always asking you why, but they don't provide any support for women who are going through infertility. And then in terms of religion, they actually used it as a source of support. And they didn't feel like religion pushed them to feeling like they had to have children. But rather they used it as like a way to connect with God and felt like that was their reasoning to find a deeper connection, is because they were going through infertility. The study was unique in that it was one of the first studies that explored the lived experience of second generation Muslim American women, as well as decision-making factors and acceptance of infertility treatments. Findings from the study left more questions to be answered, of course, like many other research. The need for further research and exploring the role of religion and religiosity on the experiences of infertility in ethnic and racial minorities. Um, the other thing that came up quite a bit is the traumatic life events or the trauma of the infertility journey itself and its impact on their experiences, on their psychological well-being and decision making. So I had a few participants talk about miscarriage as well as their infertility struggle and how that impacted their overall quality of life, and traumatic life events in terms of losing a loved one, or going through the actually IVF process is the unknown. And many people think, okay, you just do IVF, you should be able to get pregnant right away, not realizing that sometimes people go through 3 to 5 cycles or 10 embryo transfers to even get pregnant, and some are not successful at all. And so, upon finishing my dissertation, I was prepared to move forward with my academic pursuits. And so, like, 3 areas that I really want to focus on for the rest of my research career is the reproductive and sexual health education, is one of them. And right now, I'm working on this study, and I'm actually recruiting participants, and I've already recruited and interviewed, I want to say about 15 participants, and I've had 10 more say they want to interview. So reproductive decision making in regards to sexual health education and reproductive health in the Muslim American women, as we know that it's in the literature, it's very scarce. Some research has been completed. Most of them have been done in Muslim majority countries. Islamic teaching allows Muslim women to make informed decisions on, again, contraception, abortion, and fertility treatments within certain guidelines, as we said earlier. The difficulties rely more on the actual knowledge of women being aware of their Islamic rights, the cultural differences on women's health and women's rights, and then being in an area where it's kind of a mixed identity, where they have 2 cultures. So they're American culture, and then they're also from another culture. And so those are sometimes clashing. And then what I did find in the literature showed that Muslim women avoided accessing care. And so they only received care if there was a problem. They wouldn't go for like an annual physical. They didn't do breast screening. They didn't do cervical screening. They had poor reproductive and sexual health knowledge, and they actually wanted better sexual and reproductive health education. And then, so the purpose of the study that I'm doing currently is to explore the experiences of Muslim American women on their reproductive and sexual health knowledge, and to identify their educational needs. So the aim 1 is to identify Muslim women's reproductive and sexual health knowledge and their beliefs, attitudes, and norms, practices in reproductive and sexual health. And 2, the second aim is to understand to what extent personal, community, cultural, and religious factors play a role in accessing reproductive and sexual health education and care. And so here's like my preliminary results from the 15 participants. 1 is knowledge during their early years was minimal and barely a discussion. So I talked to women who are from the US, who are first generation from UAE, from Egypt, from Kuwait, Jordan. And majority of them said they had some understanding in terms of in like elementary school or middle school, they had like a half-day class or a biology class that talked about it, but it didn't really go over a lot. It was just pretty much, this is the menstrual cycle, this is your body. Some participants talked about kind of reaching out to healthcare providers only when needed. However, their experiences with healthcare providers was not always positive. So were not educated on what a pap smear was, what cervical screening was, what a speculum exam was. And so when women who were asked, hey, do you want this exam? And so they didn't know, and they would say yes, they were left crying and traumatized from the speculum exam. It's important for us as healthcare providers to really understand that when we are going over, guidelines and importance of screening, that we actually make sure that the patient knows what we are saying and are aware of these exams. Like, this is a very intrusive exam that many women have no idea. And the other cultural barrier of a speculum exam is that many cultures believe that a speculum exam will cause the hymenal ring to break, and so they will lose their virginity. So that's the other reason why many women have avoided annual physical exams until marriage. And the major thing that many talked about was like the feeling shame and awkwardness of talking about women's health, especially like the menstrual cycle. And then some talked about feeling like they had to sacrifice their self for their partner and their children. Like, you have this cultural sense of invisible labor of a woman that, like, you should be educated and go and complete an education, but at the same time, you have a responsibility for your home, and that all that burden falls on that woman. And then there is, in terms of sexuality, the cultural barriers and standards. So there's really no discussion on sexuality in this population. So if they've heard of it, it's because they were younger and heard of it through social media or through friends. But for the older generation, it wasn't really something that was discussed. So when I talk to participants about sexuality, they kind of look at me like, what do you mean? What do you mean by that? And so we have like a further discussion, and it's pretty much the cultural standards of it's accepted for a man in the culture to do specific things and have a specific lifestyle um in terms of like sexual activity, but it's not the same for the woman, even though the Islamic perspective is no sex till marriage. It's a little different between the men and the women. And so a lot of women talked about the importance of an educational program talking about female anatomy. So one participant said she didn't know that one labia is larger than the other. So she went into the office at 19 years old, freaking out, thinking something was wrong. And then that's when she discovered the all of our anatomies are different. So she's like, we need to teach more. So she was 19. So she's like, we need more on that. A lot of the participants talked about the menstrual cycle. So not being aware of what is normal and what's abnormal. When it starts, it's starting younger for most 12, 11-year-olds are now getting the menstrual cycle, and they're not hearing about it until they're 13 or 14. So that's an important part that we should probably focus our education on. And then intimacy. So many women talked about this thing where you get married, you're supposed to have children. There's not a discussion on the intimate relationship with your partner. And so that's a discussion that they feel like should be had. And most of the participants talked about having these conversations actually at the mosque, which I was kind of in shock by. And their rationale is that if it becomes normalized in a setting and like an Islamic perspective, that maybe more women and men will be open to talk about it and it'd be less stigmatized, which made a lot of sense to me. And then, of course, this is just briefly my second area that I'm hoping to research is understanding emotional and physical abuse with women who are experiencing infertility. Um, and then and improving mental health and well-being in Muslim women experiencing infertility. And then in summary, conducting research on underrepresented groups is essential for various reasons, including the dismantling of misconceptions and stereotypes surrounding women, and is instrumental in informing healthcare providers about the roles of women within the Muslim community, far from perpetuating the narrow perspectives of oppression and the undervaluation of women's education. My study will highlight the societal and cultural barriers they face. My research acts not only as a foundational endeavor for future scholarly work, but also as an initiative aimed at fostering health equity and enhancing both maternal and mental health outcomes in this population. Engaging with the Muslim population in the United States, I aspire to delve into the rich cultural intricacies, which will be invaluable for my ultimate goal of supporting the improvement of women's health on a broader scale with a specific focus on the Levant region. And thank you for your time. I know that was a lot. So any questions?
Thank you so much, Samia. I'm going to go ahead and unpin you. And as usual, we try to leave at least 20 minutes, 15, 20 minutes at the end for questions. So please start thinking, folks, about what else you would like to know. Let me see. I'll ask one. Very early in your talk, you talked, you mentioned how much in all settings, you try to transcend differences, which you think is very different from, some of the other ways people sometimes deal with differences, right? So, can you describe a time when, in a conversation with someone, whether it was a research participant or a patient or a colleague, you feel like that went well? It was very early on your talk when you were introducing yourself.
Yeah, like the
Or what
difference,
helps it go well?
like about myself or my background, or
Yeah, in your life, because I think especially whether it's in our growing up or our home communities, or certainly in our roles as healthcare providers,
yeah.
we in fact are called on to do that a lot. with varying degrees of success and varying amounts of sort of grace or awkwardness or
Yeah.
as we navigate that.
Yeah. So for me, I always found it funny because like I always have, the nurses I work with or other healthcare providers, they'll say, I'm sorry, I know this is gonna be awkward. Can I ask you a question? Can I ask you a question? And for me, I'm very open. I'm like, you can ask whatever question you want. And so I feel like when you talk to someone who's different, just, maybe having like a side joke so they're aware that like it's not something that you're not being judgmental about that person, but you really truly want to know what their thoughts are. So like I had someone ask about like, she's like, well, I see that you guys wear like longer dresses, but then this woman is wearing what we call an abaya, but she's shopping for pants and a shirt. I'm like, because we wear pants and shirts too. And it goes under her. Sometimes we wear it under abaya, and some women don't always wear the abaya. They kind of go in between. So I'm like, for me, I just took it as like she really wanted to know. And then I've had the awful side of things. I've had um, patients say like, they didn't want me to care for them because they didn't think I would be compassionate enough because they didn't really understand my faith. Um, I've had many patients when I walk into the room ask me how long I've lived in this country for, just because their assumption is based on my faith, that my faith equals a specific language, which is not true. So at first I used to get irritated. I'm not gonna lie. When I was younger, it was irritating that I had to explain to people who live in a community where it's very mixed that I speak English and I was born and raised here. But then started to learn more. I'm like, okay, people are probably just genuinely curious and they just don't know how to ask appropriately. So just being cautious on how we ask others on their differences. But at the same time, it's really important that we do, as healthcare providers, when you're trying to care for someone, that we don't use those assumptions of like, okay, I know the Muslim community, and so I think I should be able to take care of all the Muslim women in a specific way. Well, every individual is different. And when we talk about care, we always talk about it being holistic. So it's that one person and how they identify. So asking them what's important to them and not assuming. So one thing that I was just talking to another midwife who's also Middle Eastern, because she feels like it's fine when people say, hey, you know, what do you speak English? I'm like, no, I get irritated by that. If a healthcare provider thinks I don't speak English, but maybe starting off with, hi, how are you? My name is so and so, and giving the patient time to respond to see if they understand without assuming based on their name or the way they look, they don't speak the language. Because you could look American in the sense that what people equate the look of American as being European. And so you could look like you're American, but be from Russia or Germany or France and speak a different language. And so your assumption now is that they speak English, but they don't. But you walk into my room and you thought I spoke a different language just because of my face. So just being cautious and aware of that. I know I went on a tangent. I get passionate about that one.
Oh, that's great. Thank you. Judith, did you want to just ask your question or do you want me to read it?
You can read it. Oh, I guess I can. Well, I guess since I'm talking, I might as well. So I was wondering, I might have missed this. In your research, did you find most Muslim women open to IVF or not? And if they themselves are open to it, but their support group wasn't, did they end up pursuing IVF or not?
Yeah. So majority, when it came to decision making, majority of women approved of IVF. They didn't feel like it went against their Islamic values. There was only a few that kind of went back and forth. They felt like it was acceptable in Islam, but they didn't know if it was right because they kept saying it was going against God, God's will. And so like, how could they do that? So they ended up, I think only two of the 12 didn't pursue IVF treatment just because they said they just didn't feel right about it. But their family, all the family supported it, whether they, accepted IVF or not. They never questioned. Even my own family were like, just do IVF. It's like not a question. It literally took me 3 years to accept it because in the Islamic perspective, it's a medical diagnosis, thus it's medical treatment within specific stipulations. And the stipulations, at least for majority of the Muslims, is that you can't use third-party donation and you can't use surrogacy. So it has to be your egg and your partner's sperm. And then if you have embryos left and say your partner and you divorce or he passes away, you can't use that embryo. And so that kind of like has it's specific stipulations on what you can use and when. Um, but yeah, so majority of them, I was surprised. I thought most would say no, but most of them were like, no, this is part of like Islam teaches you can use medical treatment. So yeah, majority of them did it. And compared to like the Muslim majority countries, the research that I saw who didn't find a lot of support within their community in terms of their family, they did find support.
Thank you very much.
You're welcome.
Thank you. Rebecca has a question.
Sorry, this is so interesting. So I think I just have a lot of questions about so is that actual like beliefs of the church? And so I'm just going to compare it to Catholicism because I grew up with a lot of Catholics. But like I found with Catholicism that there's like a lot of passed down things that they say are rules that really are just like things that might have been rules, decades ago, but really aren't now. Or are those actual like church holdings? And is there a rationale for them? Do you know?
What do you mean? You mean like the Islamic perspective?
Correct.
Yeah.
Like all the things you just said, like, are those actual like rules? Like if you asked your religious leaders, is that what they would tell you? Or are those just like beliefs that are kind of passed down through generations that might have once been true that are no longer?
Yeah. So the hard part when it came to like infertility treatment. So in the so we follow the Quran, and the Quran's been there for 1400 years. And so the Quran provides evidence of infertility. So you have a few of the prophets who went through infertility, and it explains that and how some of them ended up having children. It's through prayer. And so there's specific prayers that we can say in hopes that God provides us children. So of course, we didn't have infertility treatment at the time, so it doesn't really have a lot of discussion there. But back in the 1970s and 1980s, there is a group, it's an Egyptian group of scholars, and they developed what they call the fatwa. So it has been since that time. So since the advent of IVF, they came in together as scholars, said, okay, this is what the Quran says, this is what the Hadith says, and so these are the rulings based on the evidence that we believe is important. So that's kind of how they base those rulings, and those rulings haven't changed since the 1970s or 80s. It's kind of pretty much still based on that. That hasn't changed, and it's because of what they found in the evidence of the Hadith and the Quran. But again, they weren't there before; those treatments weren't there 1400 years ago. So that's kind of why they set it up that way. There are branches of Islam who agree with third-party donation, so they will go to like Lebanon or Iran and receive third-party donation, like embryos, so that they can become pregnant and then go back to their home country. I don't know if that answers your question.
That was a great and very nuanced answer, in fact, capturing the fact that it's not quite so monolithic.
Yeah. Well, I mean,
interesting that there's the split over third-party donation.
There is, and I think it's just the drive of wanting to have children. So it's just accepting it. And then when I was doing my research, I did look at the three Abrahamic religions, so Christianity or Catholicism, Judaism, and Islam, and I was surprised that Catholicism was the strictest one. I thought Islam would be the strictest one, and it wasn't. And even something as simple, and it depended on, I guess, like the feeling of that person and their church, but even the masturbation, right? So to be able to get that semen sample for IVF was not allowed in Catholicism, and Islam also prohibits masturbation, but when it comes to a medical treatment, it's a little different. It's like it's acceptable because of a reason. So I thought that was very interesting. There are some similarities and there are some differences, which I think is important for us to understand. Similarly with like abortion and contraceptive use. Like we're in a time where it's a very challenging time for women, and we're kind of going backwards instead of forwards. And so people assume based on what they think that, okay, well, Muslims, Christians, and the Jewish faith all follow the Abrahamic faith, so they all do not believe in abortion, and they don't believe use of contraception, which is actually false, especially specifically in the Muslim population.
So not the purpose of your research then, but now I'm just kind of curious. So what have you found for contraception then? That's okay, like in any circumstance, or are there like allowances for certain situations, or?
Yeah, so in the Islamic perspective, you're allowed to use contraceptive as long as it's reversible. Technically, you're not allowed to do permanent. So like a tubal ligation, you're not supposed to do unless a pregnancy is going to harm the mother. If the mother is going to get sick or die because she gets pregnant, then she's allowed to do permanent sterilization. Um, you can do contraception if it's going to harm the mom and you need to space out birthing because of that. You're, in the Islamic perspective, you're not allowed to use contraception to limit the number of children because of wealth. Like if you're worried that you're not going to have enough money to raise your children, that is not a reason why to use contraception. It's based on the mother's health. If a mom has a history of always having preterm births, so that also would be a reason why she probably should hold off on having children and kind of getting a workup and things like that. But there is reasons. She has PCOS, like there are some good reasons. And then you do have, some scholars who don't believe in the use of contraception only in other instances. So you might see some women be a little bit more hesitant, but surprisingly in my community, especially here in Michigan, a lot of women get the IUD. And a lot of women in the Levant area also have IUDs because they'll come in and say, hey, I have an IUD from back home from my country. Can you place it? So it is not typically a problem that I have seen. But again, it's the permanent sterilization that's the problem.
Thank you. We do have time still for a few more questions, I believe.
Sorry, I have so many questions, and this is like, and it's so like off to like you just talk more, and then I get more interested, and I have more topic and like more questions. So, thinking of IUDs, like I've had a lot of friends who've had IUDs placed, and like based on whether they're multi-pairs and nullipairs, like they've had differing perceptions of the pain associated with it. Is because we are like, and I mean, like. The US in general, like, are just poor at pain control with these things. Do you notice anything better in your community, maybe? Or any more or less considerations, or the same considerations for women's pain with procedures like this?
I mean, I think for the women who want the IUD, it's just they're like, I want to space out the number of kids I have. They're willing to chalk up and deal with the pain. But then you have others who are like, I have heard horror stories, so I do not want the IUD because I've heard it of the bad things. But it really comes down to the person and why they want to do it. And I don't know. It's just hard because I feel like I've placed IUDs and I've seen patients who just have a really poor tolerance to the exam, so we have to stop the exam. And then I have patients who have had no problems with placement, even if they've never had children before. And so it's really just, I think, that personal preference of they're like knowing that this thing's going to be in there. Don't have to worry about it. If they're in school and they want to complete their degree, they don't have to worry about having children. So it's really how comfortable they are with it. And then I've seen in other cultures who are they kind of question the IUD because it's a foreign object. And so in a lot of the patients, like my African American patients, they're mothers and their grandmothers are like, no, that's like a foreign thing in your body. That's just not a normal thing. Why would, that's just not something. And so they go to their moms and their grandmas, more so than like the healthcare provider because of the trust, because we have this distrust with the healthcare system and with healthcare providers, to be honest. And so they go to their family and like, look, I want the truth. And their family will tell them like, no, like this is not normal. This is abnormal. And then the pain, of course. I mean, the pain is the other issue, but it is definitely what's in the community and what's the society has. So I feel like in my community, everybody's like, oh, IUD is not a big deal. You can chalk it up. It's just a few minutes and you'll be fine. You'll be good for another 3 to 5 years if you want to. And so I feel like because of that discussion within the women in our community, they are more willing to accept it versus other communities where it's actually very talked about negatively. And so they're like less likely to use an IUD for birth control.
I have a different sort of healthcare provider kind of question, which is when you were talking about the importance of really truly explaining what a speculum exam is before doing it, because that trauma of being screened and having the exam be something invasive that you weren't expecting, you probably then never have another one. Whereas if it was explained better, maybe you would have declined for the moment and had one later, but it wouldn't have been so traumatic. What do you think? Well, do you think that the idea of self-collected swabs for HPV would be an approach to achieving the same goal, which is really figuring out who is at higher risk and then making sure those folks get the more invasive exam?
Yeah, I definitely think self-collecting would be really important, especially in this population, even for all women, if we could provide evidence that it's just as accurate with the speculum, and then if we need further testing, we can. I think it will just allow more women to feel comfortable to come in for those exams because, again, regardless of your background, you may not come back if you had a really poor experience, and you didn't understand what cervical cancer screening is. So a lot of women don't, like those in the ethnic and racial minority groups don't really understand what cervical cancer screening is. So I'll ask before I come do a speculum exam. I'll ask, have you ever had a speculum exam? And they're like, yes. I'll ask where? In the emergency room. Okay. They did a pap smear there? I was like, no, they didn't do pap smears in the emergency room. They do STI screening. And so even these patients thinking that they're getting cervical cancer screening in the emergency room, so then they don't come back for care until they're pregnant. And so we're finding, at least, when I was working at Hutzel, women who had cervical cancer, and now we have to wait to treat it because they're pregnant, or there's specific things now that we have to do because they're pregnant, and they didn't know because they thought they had a pap smear done in the emergency room, but it was an STI screening. And then so I would say, like, if we can do the collecting swabs, I think that would be at least a start. And then the explanation of what speculum is, making sure that maybe we use a smaller speculum in hopes that it isn't, because there's usually the different sizes, and we typically have like the medium. And so maybe talking them through it and making sure that, like, look, this is not going to be helpful for this patient right now. Maybe we do something else since they're not tolerating it. Even like as a midwife, somebody comes in labor and I have to do a cervical exam. I've had patients going up the bed. I'm like, okay, forget it. I'm like, we're done. I'm not even gonna try to check to see where you are. We'll figure out something else in the meantime. We'll figure out if this is true labor or not in another way, because, like, I'm not here to torture you, and I'm not going to traumatize you by me trying to do a cervical exam. And so finding ways for patients, I think, is important, and finding other ways. Like I always tell patients, I wish there was another way for me to rule out certain things without a speculum exam. And one day we will get there, but yeah, so I think just start with the education of what a speculum is, what it entails. There's just too many horror stories in the community. Way too many. Like, again, in the Muslim world, it's you're not allowed to use tampons. You're not allowed to ride a bike when you get older, or use a speculum because they're worried about breaking the hymenal ring, not realizing bulls don't do that.
Thank you. I think we have a great final question in the chat from Judith, which is, what would be some tips you can give us as healthcare providers in caring for Muslim women dealing with infertility? How can we best support them? I think that's a great question to bring us back.
Yeah. So
what did you learn from your research?
Yeah. So the women talk about the community. So that's the hard part, is talking to others in the community so that they are more aware. So providing education in other populations and other women who are not going through infertility, what it means for a woman to go through infertility when you're just talking about fertility and fertility expectations. And then in terms of a Muslim woman with infertility, I think the hardest part for them was connecting their faith. Their faith was used as a form of support. And so talking to women of, like, okay, what has been helpful for you, and what can I do to help support you without putting them back in the community to be judged. And so that's the hardest part. It's like not a lot that we can do as healthcare providers in terms of changing community. We have to go into the community and actually inform the community to really help the Muslim women who are impacted by infertility, but having awareness of what their religion means to them. I'm talking to them on how to connect with their religion, Um, some women's talked about like because of that third party donation thing is like just not having infertility providers, but like this is what we have and this is all you can do, is like maybe taking a step back before saying the only way you can get pregnant is through this. That's a really difficult thing for someone to hear. So finding a way on how to just have those discussions on the different pathways to have a baby. So I guess as health providers, just being very mindful of the differences on how their religion impacts the decisions that they are going to make. Based on, again, like what the choices and options are. So just being more conscientious of that, I think, is all we can do as healthcare providers. The rest of it really truly is done with the community. It's just working with the community. So if you're a community researcher, it's working with that community.
Thank you.
Thank you. Great, great question and a great answer. And it kind of ties to your other work in a way. You know, when we're talking about fertility, I'm thinking all of a sudden in any context, when we're teaching young people to understand it, we don't bring up the fact that sometimes things don't go right in a lot of those settings. I don't think my daughter's health class had that sort of what could cause you not to be able to conceive when you wanted to, or a couple not to be able to. And it does normalize it if from the beginning we don't sort of set this precedent that, you know, that the status quo is that everything always works fine.
Exactly. I mean, I think the only thing I remember growing up, when they talk about something that could cause infertility was PID. So
Oh,
like,
right. No, right. The reason to
yeah,
protect yourself from infections is so
yeah,
you
that was
don't get
yeah,
infertility.
that was the only thing. But how about all the women who aren't sexually active and
Right.
who will not be sexually active until marriage? So like we're forgetting all different kinds of groups, but it's just like you know, the women we talk about the menstrual cycle, like, okay, this is what it is, this is what it means, it's normal, blah blah blah. But they don't tell you like, yes, painful periods could be part of like PMDD or PMS, but it also could be endometriosis. Um, one had her period at 17. She thought she was a late bloomer and then found out she had PCOS. Like these are things that people don't know about. And then, yes, it does change your trajectory. I've met a lot of medical students who've had egg freezing. They've frozen their eggs in their 20s so that when they're ready to have kids in their 30s, just in case that they um, have something available. So that's the other thing. They're like, nobody talks to them. And the only reason why they know, the medical students know about egg freezing is because of the residents and the physicians that they've worked with. So I'm like, that's an interesting thing that I never thought of.
Yeah.
Mm.
Interesting. Great. Does anyone have any final questions? All right. Well, thank you so much. We can always tell that the talks are really interesting to people because the conversations, it really does become, you know, coffee and conversations where we get to have a conversation with people about their research. So thank you, everyone. Please join us on this same Zoom link next week for Dr. Luis Parra's discussion on a completely different, but actually still, well, actually completely different topic, but he'll be talking about the experience of youth in foster care, LGBTQ youth in foster care in Spain. Samia has, Dr. Abdelnabi has put her email in chat if you have more questions for her. Thank you again and have a great day, everyone.